think hunger and poverty can impact healthcare in a number of ways. We see a growing level of both high blood pressure and diabetes in our food bank clients today. Many of them are trying to make decisions about paying for food or paying for medicine. And I think that growing cost is going to have an impact on all of us as we think about our healthcare system in the future.
Without question, both food quality and quantity directly impact a person's overall state of health. In Arizona, nearly 3 out of 4 adults are not getting the recommended amount of daily fruits and vegetables. Poor nutrition can lead to heart disease, obesity, and diabetes.
One of the things we know is that people who are living in poverty tend to buy things that will fill them up. Those things that tend to fill you up tend to be carbohydrates and what we would sometimes consider food that's not healthy for us. But it's reasonably priced and much more affordable. And so we're seeing huge numbers of obesity in the community.
And the truth is we need to change how we're looking at kids today, because really the malnourished kid in this country, sometimes that very overweight child. And there are really 2 types of poor nutrition. There's just inadequate calories, where children aren't getting enough actual sustenance to keep them healthy and active. And then there's poor quality calories, empty calories, things that come from very high sugary foods and fat foods. We know that children who are poorly nourished are more susceptible to infections. They are more at risk for pneumonias, ear infections, throat infections, and different problems there.
Oral and dental health are also affected by poor nutrition. Current research shows there may be a connection between gum disease and heart disease or other illnesses.
The effects of poverty and poor nutrition on oral health, as a dentist, I see them as threefold. I see pain, infection, and I see missing teeth. When our patients are missing teeth, often they will shy away from healthy foods. Fruits and vegetables are a little bit more difficult to chew.
I couldn't eat anything that wasn't soft for a lot of years. And so I was living on mashed potatoes and mac and cheese and soup, which, as it turns out, is not a nutritious, balanced diet. Most vegetables are crunchy.
Poor oral health affects the ability for my adults to gain employment. So if one is missing teeth and you go in for a job interview, they're not going to hire you because you're missing teeth. Or 2, they're going to place you in a job position that has no public exposure, so you're probably going to get less pay. But more often what I see is that they're not hired at all.
I've been told to my face by employers that I didn't look the part. I've been told that I wouldn't be a good reflection on their company. I've been told that on paper I'm a great candidate, and then just never gotten a call back. I get that a lot.
I'm going to start off by looking in your ears, all right?
So the cycle of poverty continues, resulting in job limitations, healthcare disparities, and higher costs for everyone. In the United States, billions of dollars in healthcare expenses are attributed to poor nutrition every year, ballooning costs that have long-term effects on families and our state's fiscal health.
Families who wait until their children are really sick, they don't always end up going to the pediatrician's office. They'll end up going to the emergency room. Or parents will seek care after work because they can't get to the doctor during work. So this is, again, emergency room care, which is very expensive.
Taking the long view, one way to prevent high healthcare costs is through quality nutrition.
With Nourishing Arizona, we hope to educate the state about the connection between good food and good health, how it impacts the way you feel, your ability to contribute to your family and your community, and ultimately impacts your long-term health and what you may need to pay for that health.
Hunger, employment, healthcare. This is a very complex issue. But if the cycle of hunger and poverty can be changed, our entire community will ultimately benefit.
So the hunger issue impacts everybody to some degree, and I think there's nothing more rewarding than to see a kid or a child today not just get fed, but be properly fed, so they're off to a good start of growing up to have a healthy life.
Good, nutritious food prevents hungry stomachs today and helps prevent high healthcare costs tomorrow. Talk to your doctor about a healthy diet. If you're uninsured, you can find health insurance with the Affordable Care Act. Join AAFB and ACAA in our fight to end hunger. For more resources to help children and their families, visit azfoodbanks.org and azcaa.org. Imagine a solution.